Epilepsy. What is it? How does it happen? How is it controlled? And what do you do during a seizure? Though these are common questions that should be asked, a lot of people can't answer them. Epilepsy is the fourth most common neurological condition after strokes, migraines, and Alzheimer's disease. But even though it's so common, it's also one of the least understood major chronic conditions, even though 1 in every 26 people in the United States develop epilepsy at some point in their lives. But I want to change that. I want people to be able to answer these conditions, to know how it works and how it's controlled and what they should do during this time. So first, what is epilepsy? Epilepsy is a neurological condition causing the brain from excessive brain electrical balances. Sorry. As you can see from the pictures, when the electrical balances aren't even, a seizure occurs. So pretty much epilepsy is the act of having a seizure. Yes and no, because in life, a lot of people actually only have one seizure, and many doctors only diagnose people with epilepsy after they have more than one seizure. So the best way to figure out if a person has epilepsy is getting details of their medical history. Like in my case, I have a grandfather with epilepsy, taking things like blood tests, EEGs, brain imaging tests such as CTs and MRIs. A EEG is when cords are stuck to your brain in different places to help the doctor scan your brain. And as from the picture we saw before, it shows your brain waves, which lets the doctors know when your brain is not in order. For an MRI, it's pretty much taking the X-ray of the brain. You just lay down on the mat, and the bed goes into the machine, and it takes a scan of your brain, so the doctor can tell you what might be the problem. So how does a seizure happen? Well, everyone has different epileptic triggers, but the main and most common ones are stress, sleep deprivation, flashing lights, and specific foods. Like in my case, and one of my specific foods that I'm not allowed to eat would be grapefruit. And learning your triggers, you not only help yourself to better protect yourself, but actually help those people around you to protect yourself. And knowing my triggers, when I go to my boyfriend's house and my friend's house, I'm able to inform these people of these things so they know what to do. A normal brain wave goes at a rate of about 30 per second, but in a person with epilepsy, they have different patterns and flashes in their brain that helps them to struggle. Seizures are divided into multiple sections, but one of the most common are partial seizures and primary generalized seizures. The difference between these two are where and how they begin. In primary generalized seizures, they usually begin on both sides of the brain at once, while for partial seizures, they happen in a limited area of the brain. Primary generalized seizures are usually hereditary, meaning they're passed down from a parent. But for partial seizures, there's usually something that causes, like having strokes, tumors, or a birth injury, and sometimes the cause is unknown. Hereditary factors in primary generalized seizure are the most important factor, while for partial seizures, genetic factors are the most important. So, what do you do during a seizure? Can I have someone come up for me? Okay. Well, during the seizures, at this time, it's best to lay the person on the ground and to put them on their side. So, come on down for me, Mom.
You getting this?
And then it's best to put the person on their side because during this time, a person has a habit of slobbering, as well as the fact that many people bite their tongue and can choke on the slobber. Secondly, it's best to put something soft under your head. In many cases, we'll have multiple pillows around, but in a case where you don't have a pillow around, it's just the fact of getting something soft. So it would be something as simple as taking off a jacket and putting something under their head. Secondly, you need to move things off them and around them. For example, we probably, if she was closer this way, would move back the TV and the table to help her to protect herself. And then take sharp objects that can harm them off of them. Things like their glasses, bracelets, necklaces around their neck, and also a tie. And lastly, you time the seizures. In many cases, people do call the ambulance when they don't know what to do, but a lot of the times there are cases where people don't call the ambulance after the seizure's over. Many times the person's just put in a bed, and when they become conscious again, they awake. The times that it's most important to call the ambulance is if the seizure lasts longer than 5 minutes, if the person comes into another seizure after coming out of one, if they were pregnant, if they were hurt during the seizure, or if the seizure happened in water. But with so many do's, there's also multiple do nots. It is not best to hold the person down. And holding the person down during a seizure, you can actually do a lot of damage to their bones. As well as said, it's not safe to put something in their mouth. As a young girl, I had many people tell you to put the spoon in their mouth to hold their tongue down during a seizure, but it's been proven that a person cannot choke on their tongue. And if you choke and if you put the spoon in their mouth, there's actually a good effect that you could do damage to their teeth as well as their jaws. And lastly, it's not best to do CPR because many people, when they come off the seizure, begin to breathe on their own. And it's best to wait till they're alert before you give them things like food and water. So how is epilepsy controlled? Well, the first step to controlling epilepsy is to know that you have epilepsy and what type of epilepsy you have. This time we can get back up.
Good, Mama, you remember?
I might be able to get Well, the first step is what many people go to their primary doctors who would diagnose them to a neurologist. A neurologist is a doctor who studies disorders of the brain, which includes epilepsy. And in more advanced cases, when you need special training for the study of just epilepsy, you would go to an epileptologist. The first and most common things that people give to people with epilepsy is anti-epileptic medicine, which helps them to calm down their brain during this time, during the seizure. But it usually depends on multiple factors like the age of the person, other conditions they have, and the frequency of their epilepsy. Well, ketonic diets is one of the oldest methods, and it's pretty much a diet of eating specific foods, drinking specific foods, and eating certain vitamins to keep their body healthy. There are multiple other studies to help epilepsy, like biofeedback, eating melatonin, as well as large doses of vitamins. And one of the most common surgeries that have become is VNS surgery, which is the surgery that I had recently myself, which stands for Vagus nerve stimulator. A pacemaker is placed into the chest, as well as a cord is connected to the vagus nerve, which is here in your neck. And when the magnet in the bracelet that you have to wear at all times is placed on the spot, it actually sends waves to the brain, which helps the brain to calm down during seizures. So in the end, I truly hope this helps you to understand more about epilepsy and what to do. With epilepsy continues developing, it's best to know how to help yourself as well as those around you, because in the end, no one knows what the future holds, but it's always good to be ready. Thank you.
Woo!
Can you cut that part out so you getting it?